the first Deputy Chief Medical Officer for Mental Health, Dr. Ruth will be appointed. She's a former chief psychiatrist in Victoria, a very distinguished and extremely capable person. Her role is twofold. One, obviously, during the course of the pandemic, to add to the support that we have for mental health. And then secondly, beyond that, to look at the role of mental health in coordinating with the states and territories and the Commonwealth. One of the things that, on our watch, both the Prime Minister and myself have identified is not just the importance of mental health, but the importance of integrating what we do with the states. And so we're working very constructively. The Prime Minister's requested, and there will be a pandemic mental health plan taken before the National Cabinet on Friday. But we've been working very constructively with the states in particular. New South Wales and Victoria have helped take the lead at the state level. They've worked with Christine Morgan, the National Mental Health Commissioner. Everybody's being very constructive and focused. We know during any economic crisis, there's a long history that this can have a demonstrated impact on mental health. When you add that to the uncertainty of a health crisis as well, it's completely understandable that there is a risk, and that's why we're getting ahead of the curve, just as we've done with health, now on mental health.
What's the data on the number of people who have committed suicide during the pandemic as opposed to the number of people who have died from COVID-19?
I don't have anything on that yet, and what we often see is that there is, through the coronial process, a period where they have to determine the cause of loss of life. But we are establishing, as part of our work, something which was in place and being developed before the pandemic, a real-time data process, $15 million going into that, so as we can have early warning. At this stage, we don't have any indication of a spike, but we have certainly not ruled it out. We're planning, preparing to try to get ahead to provide the support for Headspace, Beyond Blue, Lifeline, Kids Line. All of these things are very, very important. The Black Dog Institute to help with our medical professionals who've had heightened stress, heightened conditions. They've done an amazing job. So on all of those fronts, we're acting early, just as we've done with the virus, but to make sure that we do everything we can to give people the support, because whether it's isolation, whether it's health, whether it's economic anxiety, all of these things can understandably have a huge impact on people's mental health. So this is an important step forward. It's for the first time in Australian history raising mental health to that level of the Chief Medical Officer's unit. And I want to thank the Chief Medical Officer, but also people such as Pat McGorry and Ian Hickey and so many others who have advocated for this position.
I guess, is it realistic to expect that, the severe ramifications of mental health being suicide, that the numbers may well end up being more than those people who died from COVID-19, which at the moment is about 97, right?
98 as of this morning, very sadly. I won't make any predictions here. Our job is to look at the risk, and we do know there's a risk, and then to try to get ahead of that curve, which is why we've invested in all of those services. But the other really important thing that we've done is provide telehealth. And so now we're at approximately 9 million telehealth consultations since it was introduced. A very significant proportion of those on the reports of our GPs are for mental health. And so it's providing that service to people in their own home when they are potentially isolated, when they might be lonely, when they might have anxiety or pressure, all the things that are completely understandable, and saying, it's okay. We really want you to reach out. We really want you to get that help. And this has been a huge development, telehealth, and it's been one of the things which the pandemic has allowed us to bring forward. What was going to be a 10-year migration plan, we were able to do in 10 days. And it's taught us the speed with which we can make systemic change, but much more importantly still, it's given those that are at risk the additional support at the time they most need it.
Is this all in anticipation of a second wave?
Well, our job is to work to try to prevent that, but we have never ruled that out. We have to be careful not to think that this is over. We haven't beaten the virus. We are winning, but we have not won. And so we always have to be vigilant. This is an ongoing crisis. And although we have flattened the curve, we are looking every day for new outbreaks to use the contact tracing, which is why we're encouraging as many people as possible to join the 5.6 million Australians who've downloaded the COVID Safe app, because it can help protect you, because it can help protect others. It can help protect our nurses. So we're not out of the woods. We are doing exceptionally well as a country, but we have to be ever, ever vigilant.
Just brought up the Treasurer. I'm sure you're relieved that he's been cleared of COVID-19, but as Health Minister, will you be having a quiet word to him this morning about coughing into his hand and not into his elbow?
He's already spoken to me about that himself. It was the first thing he raised with me.
What did he say?
I've had a chat with him this morning. He said, "Oh, they should have coughed into my elbow. Sorry about that." So, but look, he did exactly the right thing. He sought medical advice out of an abundance of caution. He had a test. He self-isolated, and now that it's a negative result, he's coming back to work today. You can't keep him down. He's as energetic and as enthusiastic as ever.
So you don't need to scold him.
Oh no, he was right onto it himself, and most importantly, he sought the medical advice and followed the medical advice, both in terms of the test and the self-isolation. So it's a good example for all of us of anything can happen, and any one of us can inadvertently catch an illness or pass it on. And so we don't ever, ever, ever want to be judgmental. We want to make sure that we're encouraging people to get those tests. Now over 880,000 tests conducted in Australia. These are the things that are catching the virus early, they're saving lives, they're protecting those people that have been infected, and they're protecting against other infections. And that's why the testing and the tracing, the downloading of the COVID Safe app, they're all so important to protecting Australians against a second wave. Now, we're doing well, but we have to be vigilant.
OK. Health Minister Greg Hunt, appreciate your time this morning. Thanks so much for joining us.
No,